Hi Kevin, welcome. It's great to talk to you today, and thank you for presenting earlier on social licence, whether it's an accelerator or a break to our current health communities. Can you explain a little bit more in terms of that, how you feel whether the social licence is an accelerator or a break?
So I think today you see it as a break,
Right.
but in the future it's going to become an accelerator if we get it right. I think we're in a situation where people are just starting to realise that when they give permission for their data to be used in whatever way a website or a service expects, that can mean all sorts of different things in different scenarios.
Right.
Health has this opportunity where actually there's all sorts of great benefits to people to use their data in good ways to lead to better outcomes, but today we are a bit scared to go down that path because we're aware of some of the risks that are there as well.
Okay, so in helping those that are watching to understand, what do you mean by social licence in terms of the data access that you're talking about?
So social licence is really about ongoing public support for what you're doing.
Right.
So it's a pretty vague term in the sense that it does evolve over time, and it's quite different to sort of a legal license. So it's not about whether a box has been ticked so someone's allowed to do something. It's more that if the public's aware of what's being done, is there general public support for that?
Right, okay. So we've just been talking about access to information. How do we go around tackling the privacy and security of that in terms of social licence?
So a big part of social licence is transparency. So being really clear with people, hey, you're sharing this information, here's what we're going to do with that information, here's what we're not going to do with that information. If you want to change your permissions and consent, this is what you need to do about it. It's that really open conversation with people about that information.
Right.
What you tend to find in health is that people are quite willing to share their information for the public good. So people, if you ask them in general if they're willing to be part of a study for people with a similar condition, in general people are very supportive and quite willing. And actually what often happens in health is we share information less than people actually expect us to.
Right. So it's about providing them with the choice and the ability to both see and access that information, but also know where it's going. Is that right?
That's right, yeah. But I think the health sector also has a bit of a responsibility to tell the world about the good outcomes that are coming from this. So this is what we've been looking at, and actually we've found these things, and this is how we can actually make a difference by using that information in a sort of a wise way.
Right, so it's about empowering our patients to participate in the research potentially that's going on with the utilisation of their data and information?
Yeah, certainly. So giving people the ability to be part of the research, but also just even just part of general practice in terms of, I've got this condition or I'm wearing this device and we're not quite sure what it's being used for, what it's going to be useful for in the future, but I'm happy for my data to be shared and I'd like to see the results of that research so I can actually understand what's going on.
Right, so that's going to be pretty powerful in the future and hopefully will certainly generate a far more greater, a connected community of our patients.
Absolutely, yeah.
Thank you very much.
Pleasure.